So the Leukemia Lymphoma Society set up a registry to examine the response to vaccination, COVID vaccinations. And we've been conducting this for about the past 2.5 years. We've looked at response to the second vaccination and now the third vaccination, which is sometimes called the booster. Actually, the booster is really a required vaccination for immunocompromised patients, and this includes the Waldenström's patients as well. What we found was that if you did not have a serological response, that is making no anti-spike antibodies after the second vaccination, about 40% of the patients will indeed have a positive serological response, meaning anti-spike antibodies can be detected. However, among those 40% of patients, only half of them produce antibodies that are in a range where neutralization begins. In other words, you need a certain level of anti-spike antibodies to achieve neutralization or ability of the antibodies to block the infection in cells. So roughly about 20% of the patients who are seronegative after 2 doses produce meaningful levels of anti-spike antibodies after a third vaccination. Oh, I should add also that in the event that you were positive, in other words, seropositive after the second vaccination, most of those patients will produce a high level of anti-spike antibodies after the third vaccination. So what does this mean overall? This means that a considerable amount of patients, including those with Waldenström's, who can be considered immunocompromised, are still unprotected against COVID-19 infections because they're not making anti-spike antibodies. And they need to be cautious. They need to maintain their vaccinations, get EvaShield if needed, report to their doctors if they get an infection immediately, because there are antivirals and monoclonal antibodies available to protect those patients. And of course, mask up, maintain social distance, and get everybody who's in the immediate family or surrounding them vaccinated so they don't get COVID.